Fidelity just released their 2025 retiree healthcare cost estimate, and the numbers are staggering. A 65-year-old retiring in 2025 should expect to spend $172,500 for healthcare costs. In today's episode, Mark and I will talk about what's included in that figure, what's missing, and what you can do to prepare.
It's easy to get lost on the way to retirement. Things like taxes, improper planning, and excessive market risk can all lead you astray from your goal of a successful and happy retirement. That's where Liz Whittaberry comes in. She's a holistic financial advisor and the founder of Best Path Advisors, and she can help guide you to a better financial path. This is Retire on Your Best Path with Liz Whittaberry.
Welcome into another edition of Retire on Your Best Path with Liz Whittaberry and myself to talk about the retirement healthcare costs that have jumped again. It's kind of a 2025 update as we are winding down the year a little bit. And we've got this study, I guess, or this thing here, Liz, that we're going to talk about from Fidelity on retirement healthcare cost estimate. And yeah, to your point, and kick things off, 172.5, that's hefty.
It is. And people don't realize how big the number could be because they haven't been thinking about it. What is healthcare costs in retirement? You know, this is growing faster than inflation. In 2002, when Fidelity first started this, the estimate was $80,000 a year. Now in 2025, $172,000 a year, more than double.
And that sounds pretty stark, but if you break that down over a 23-year period, it's like 3 and some change percent. But to your point, that's outpaced regular inflation in that same time period, obviously.
In that same time period.
Yeah, other than that little blip we had with the really high stuff. But yeah. So what does it include? And why do these numbers, I mean, it sounds fairly scary to folks when they hear that.
It does. Now, that includes your premiums that you're going to pay for original Medicare. That's their assumption. Mm-hmm. And your Medigap plan, your dental, your vision, your out-of-pocket costs for your deductibles, and then medicine costs. So it includes the basic healthcare costs that you're going to pay out of pocket if you choose the Medicare, the original Medicare, which is the one that I prefer. It does not include long-term care costs, and that's a big deal because people sometimes don't understand that Medicare doesn't cover long-term care costs. Long-term care is not the kind of medical expense that we get covered by a medical policy.
Mm-hmm. Yeah. Yeah, and obviously, many folks are concerned about retirement. And when it's funny when you think about the kind of the feeling behind, like, we know it, we're afraid of it, but yet we don't talk about it. It's like 1 in 5 Americans haven't even really put much thought into it. And interestingly enough, my generation, Gen X, is woefully underprepared, right? So let's talk about some of the common blind spots and some things that you were noticing in this report.
A lot of people just don't realize that Medicare doesn't cover everything. It's not free. Just Part A
right,
is free.
Right.
If you've paid for, if you've paid in at least your 10 years of Social Security taxes, then you get Part A for free. That's hospitalization. But Part B for your doctors, that's not free. You've got to purchase that. Part D for prescriptions, you've got to purchase that. And then if you want to cover all of the deductibles and limits that Medicare has, then you need to buy that Medigap policy. So It's not free. It doesn't cover everything. And people don't understand how much they're going to have to pay. And they don't look at putting those plans, that cost into their spending plan because they're currently on a healthcare plan where their company is covering the premium. It's just out of sight, out of mind. They're healthier. They're not using it as much a lot of the times. And so they just haven't plugged it into that annual spending plan. And I see that a lot. And that's one of the things that I talk to people about. We've got to build in this other cost for healthcare because you're going to be paying for it yourself over and above, what Medicare would cover. And JP Morgan also does a annual estimate in their retirement planning research. Mm-hmm. And they're estimating that the average annual cost right now this year is $6,856 per person. Now, that cost is going to increase by inflation, but it's also going to increase by age. And so JP Morgan is suggesting assume a 6% increase in that cost.
Okay. Yeah, 6%, right.
Because you've got your age increase plus inflation.
Well, yeah, I mean that's and that can get hefty and that can stack up. And
Right.
you're talking about things not being free. So as an example to that, and I think there gets to be interesting confusion along there. So I took my mom in for cataract surgery, right?
Yeah.
And she's in her 80s, and they were going through the options that Medicare would cover for her. And she's on a fixed budget and so on and so forth. And they're like, so option A, it's kind of funny thinking about it now. Option A was like the I guess the base or whatever. And that was pretty much mostly covered by Medicare for the cataract surgery.
Right.
With the lesser lens. Then they started talking to her about better quality cataract lenses or whatever, and that kicked the price up. And of course, Medicare would not cover that, right? And it's like, I swear, I thought one was like Gorilla Glass. I know it wasn't,
Right.
but like the kind of stuff that they put on our cell phones. But anyway, so she would have had to come out of pocket, or I actually came out of pocket to get her a better quality lens put in. And so that's where some of that confusion comes in, because part of it was free, so to speak, but it was like the cheaper, lesser option.
Right. Medicare is covering what you need,
The
not
base, yeah.
necessarily what is really giving you the best quality of life.
Right.
And there's a big difference there. My husband has had cataract surgery as well, so we went through that whole process. I know exactly what you're talking about,
Okay,
and
yeah.
I've seen a lot of other
It was
people,
wild.
that have gone through that process, clients that have gone through that process as well, and trying to decide, do I want this level or this level or this level? And there can be,
Yeah.
some pretty high levels, and the same is true with hearing.
Okay, yeah.
There's a lot of areas where it's not necessary to live to have these nicer things, but it really does add to your quality of life, and you want to build in the ability to have the best quality of life.
Yeah, that's a great point. Yeah, exactly. So I'm glad you know what I'm talking about there. So, well, okay, so let's talk about an HSA, right? So we have that, and I'm going through some health things as well, and as having an HSA is pretty awesome. Like, now I know it's not everybody doesn't have access to this, but let's talk about some of the potentials there.
Love HSAs. That's one of my favorite accounts, and in fact, we did episode number 6 on the HSA Super Roth. So people can go back and listen to that and get some more insights. But HSAs allow you to put money in. It's tax deductible. It grows. You don't pay any tax on the growth. And if you then take the money out for medical expenses, you get to pull it out tax free. So it becomes completely tax free. This is a triple tax advantage. It's better than any other kind of retirement account. And when I say retirement account, you can use this for retirement. You can put money into the HSA, save it up, let it grow without any tax, and then down the road in retirement, pull money out tax-free.
Yeah, you can even invest the funds.
You can invest the funds, and a lot of people don't realize that they can because they're so used to the flex savings account, which was the old use it and lose it, which are still around. It's lose it and use it, and so it's set up for the money to go into a, just kind of like a money market where you can then turn around and spend it. And with the flex savings account, you had to spend it that year or you lost the money. With the
Gotcha.
health savings account, you don't lose the money. If you don't spend it that year, it's yours, it's vested, it continues to grow. And even if you have medical expenses, you don't have to reimburse yourself in that same year. You can wait and reimburse yourself 5 years, 10 years, 15 years down the road after you've had some tax-free growth, and you get to keep that tax-free growth.
Mm-hmm. Yeah, and to your point, about half of folks that even have one over the age of 55 don't even realize that it can be used as a vehicle, right, as a retirement
Right.
savings vehicle. So if you've got one, talk with your, with your financial professional, or reach out to Liz about, hey, how can I maximize this thing? Because it's an awesome vehicle. So something to think about
it
there.
is.
Okay, Medicare complexities. Let's talk about some of the stuff that was in there and the report on that.
Yeah, the report pointed out that about almost 40% of people expect Medicare is going to cover most costs, and that's a misconception, as we've already talked about.
Right.
And then more than half of the people anticipate enrollment is going to be difficult. And it is confusing because there's so many choices. You start getting a billion, letters in the mail telling you to sign up for this plan or that plan, and how do you choose? So it is a good idea to get some education about how Medicare works. We did do episode number 32 on all about Medicare. So that would be a good one for people to go back and listen to as well.
Yep.
But there are organizations that, I refer people in this area to agents and educational firms that put a lot of information together that explain more than just the basics. So when I'm sitting
Yeah.
down with my clients, we talk through the basics, we talk through the the key options, what would I recommend? But then I have them go to somebody that really is specializing in this area and get more detailed insight into their particular situation so they know they're making the right decision for themselves and for their family. And I think that's the key.
Mm-hmm.
Get somebody at the outset, get somebody to help you look at your situation, your health, what do the different plans cover, which plan would fit what you're looking for, and make it. Because when you go on Medicare, you can choose any plan with no underwriting issues at all. But then to make a change later, you will have to qualify medically to switch from one thing to another. So
Yeah.
that first decision is a really important decision.
Well, and a lot of people, to your point, a lot of advisors do have folks that they refer people out to kind of Medicare specialists. There's some great resources online too, not affiliated with anything, but like, boomerbenefits.com, for example, is a great resource.
That's one of the ones that I refer people to look at their videos because they are very good.
Yeah, and they've got great reviews and they're very informative. I don't even think they charge anything. So I think it's a great resource to get some more education, to your point. But if you're working with a financial professional, often they will have somebody that they refer people out to locally as well to kind of just help, solidify that relationship. Because it is, we talked often, Liz, about having kind of that financial team. That's kind of part of it, right? CPA and, the legal side of things, Medicare side of things, it helps to have those resources. So good things to think about there. What are some strategies? What can we talk about for folks today to help maybe reduce the stress?
Well, I'd like to talk about 4 things. So first of all, you want to start saving as early as possible. Get an HSA opened. Even tell your kids. I told my kids as soon as they got their first job, if they had the ability, get that open and get it started, because that compounding is going to make a big difference in how much you end up having in, when you reach retirement. Number 2, use that HSA strategically. So don't use it like a flex savings account where you're putting money in and then immediately taking it back out and you're not getting any growth or compounding on that. Reimburse yourself later. Save your receipts. Set up a really good system for scanning the receipts, keeping copies of, the fact that you did not itemize and deduct those medical expenses that in that tax year so that you can come back later and reimburse yourself and have all the growth in the meantime, because that's going to help with your medical costs in retirement. Number 3, you want to think about how you're going to manage your retirement income so that you don't push yourself into a really high income bracket as far as the IRMA cost. IRMA being the income-related monthly adjustment amount that increases the Medicare premium. So when you're entering retirement and you're beginning to pay for Medicare premiums, you want to make sure that you keep those income spikes from happening to the extent possible so that you can keep that healthcare costs as low as possible. Now, you've got other things to think about. Am I doing Roth conversions and what's my tax bracket? And there's a lot of coordination to look at, but that is one of the important things to watch. Mm-hmm. And then number 4, you want to talk with your advisors. You want to talk with your family. You want to know what your plan is. And you want them to know your plan. So you don't want to go it alone. You want to get that professional input. You want to know what your numbers are, run your plan, make sure that the healthcare costs are built in. And then you want to talk with your family because you want to know that they know what kind of care that you want, how you want to pay for it, and how they can help you at the point in time that you need that care. Like you're providing help to your mom. Mm-hmm. It's important that you understand what she wants as well as what's available, what would be good for her, how can you help? And that's the thing that you want to talk about with your own family so that they know how to help. It's not an emotional burden trying to guess.
Yeah, that's a great point, right? Because healthcare is really, it's a wild card, really, in retirement, if you think about it, right? And Fidelity's estimates, again, we talked about the staggering number there. It wasn't meant to scare folks, right? It's just meant to prepare you. You got to have that plan in place like you talked about, Liz. Don't just hope that Medicare or your savings will cover it, right? With the right planning, ideally, you can make healthcare just another line item in the retirement budget, right? So you want to make sure you got that strategy in place.
Yeah, it does not have to be an afterthought, and it doesn't have to be a potential financial shock to your retirement plan. So when you plan, you can be on the best path. for your healthcare costs as well as all of your retirement.
Exactly. So if you need some help, as always, reach out to Liz, bestpathadvisors.com, bestpathadvisors.com. Lots of good tools, tips, and resources there. Get some time onto the calendar and check out some of those resources, by the way, on the good stuff there. Check out our YouTube channel, subscribe to that. And don't forget to subscribe to the audio podcast here as well on whatever platform you enjoy using. And that way you catch new episodes when they come out. This has been Retire on Your Best Path with Liz Whittaberry. She's the founder and financial advisor at Best Path Advisors. And we'll see you next time right here on the show. Thanks, Liz.
Thank you.
The preceding program is sponsored by Best Path Advisors, which is solely responsible for its content. Securities offered through J.W. Cole Financial, member FINRA SIPC. Investment advice offered through J.W. Cole Advisors. Best Path Advisors, J.W. Cole Financial, and J.W. Cole Advisors are unaffiliated entities. The opinions expressed by Liz Whittaberry should not be construed as specific tax, legal, or investment advice, nor as an offer to buy or sell any securities mentioned herein. Neither J.W. Cole Financial nor its representatives provide legal, tax, or accounting advice. Persons who provide such advice do so in a capacity other than as a registered representative of J.W. Cole. Investing is subject to risks, including the loss of principal. Due to volatility within the markets mentioned, opinions are subject to change without notice. Information is based on sources believed to be reliable, however, their accuracy or completeness cannot be guaranteed.